Hi, and welcome to podcast number 4 for Samarpan. And today's special guest is Dr. Ashish Deshpande. So, Dr. Ashish, welcome to our podcast. Maybe you would like to introduce yourself and tell our audience, our viewers, a little bit about yourself and your area of work.
Thanks, Martin, for having me over on this podcast. And friends, I'm Dr. Ashish Deshpande, very much from Mumbai. Got trained in KM Hospital Department of Psychiatry, and for the last 30 years I've been practicing in Mumbai. Have had a keen interest in addiction psychiatry right from my residency days, and I pursued it, and I'm doing some kind of community work and research work in addiction medicine. I'm closely associated with the fellowship in India, and have learned a lot about the disease through my clients. So that's what I am, Martin.
Okay, just to tell you, a lot of people probably wonder why did you end up in the addiction field? It's a sort of a field that a lot of people move into because of personal experience or because they just fall into it. A little bit like me, I fell into it, but obviously got personal experience. But you know, how did you come to become involved?
It was, I think, solely a problem of my curious mind. Okay. And when I entered psychiatry at that time, I started seeing patients, and of those patients that I could see in psychiatry, there were a few patients whom I just couldn't associate even after they got well. Okay, their illness and the incapacitation that they had probably did not allow them to be a productive part of the society.
Yes.
And mainly because I was in a tertiary hospital which catered to the lower socio-economic class where I got the training. Then I realized that when I started my private practice, I was so wrong at that time. But in that time, whenever I would go to the Center of Excellence in De-Addiction, which is there at KM Hospital, late Dr. L.P. Shah started that center. And when I realized that I started working there, once the suffering alcoholic or drug addict would get his act together and was able to get some kind of sober period, he was just like me. I could talk to him, I could interact with him, I could have fun and jokes with him, and drop my guard and just be happy with him. Yeah. And that wouldn't happen with any of the other clients. And what was curious for me was that once the patient through the recovery, he goes into that certain kind of a negative mental state where he wants to consume the drug. Okay, that is the time when this guy would never even think about what the consequences would be.
Yeah.
Okay, so what brings about this fatalistic thought process? Okay, because he is a sane person. Okay, but chooses an insane path in spite of what the evidence has been, what the experience has been.
Yes.
Okay, and that got my curiosity going. So what is this insanity? Yeah. Okay, maybe that was the reason why I got attracted to this particular field.
So the almost the insanity of the insanity.
Absolutely.
Was quite different to working with maybe general psychiatry, where you have an understanding of really what's going on because of the person's diagnosis. Whereas in this, as you say, sometimes you look at someone and say, well, you've got all these consequences, all these things have happened. Right. This, you've lost your family or your physical health is impaired. Yet all of a sudden you still have this compulsion to carry on.
Absolutely.
Or return to use.
And at that time, I was reading a book called Subtle is the Lord by Albert Einstein.
Yes.
Okay. And Albert Einstein in that book says that God doesn't play dice. Okay. There is thought process, and for him, what was science? Science is what God thinks.
Yes.
Okay. So when a person behaves in such insane ways, okay, what is God thinking? What is happening in his brain? Okay, and that was something which stuck to me, and as of now, even I feel that his famous quote on insanity was doing the same thing and expecting a different outcome.
Yeah, which
and we commonly see in alcoholics and drug addicts, my friends. They always believe that the next drink would be the drink that they would be able to control.
Yeah, I mean, it's amazing. I mean, it's just got me thinking a little bit, and I can remember back sort of early in my career in terms of in this field, and I was working with a gentleman that actually had the same first name as me, and when he came into treatment, he was really this sort of colour.
Okay.
Okay, so he was pretty damn yellow, and his doctors had told him that that his liver was so badly compromised that the likelihood was that he would need to have a liver transplant.
Oh,
there was a slim chance that if he did stay abstinent, that he may not necessarily need it straight away. And what fascinated me was that the first 3 weeks of treatment, this client was fully engaged in his program. He was sort of, we'd worked through all of the cost benefits. We'd worked around about relapse prevention. We'd sort of worked around about, all the consequences of what's been going on, some education around his condition, and he was fully engaged in, okay, I really understand the need for abstinence-based recovery. And I remember coming in, I think it was in the third week, halfway through the third week, he said, "Martin," he said, "I've been thinking." And I said, "Well, that doesn't sound good to me, because as you know, that thinking's not always, sometimes, ask someone else as opposed to, I'd like to just be able to have that one drink." He said, just that one where I can, at the end of the day, I have that margarita that finishes the day off. And he was fixed on that.
Yeah,
and at that point, he was fixed on, I think I can do this. And I thought, damn, this is really sort
crazy.
This is crazy.
Yeah. And these Alcoholics Anonymous, they have this big book. Okay?
Yes.
And there is a sentence in that, okay, that every alcoholic carries a dream of controlled drinking.
Yes.
And he carries it to his cemetery.
Yes.
So that's what happens. That's what happens. That you keep on experimenting, okay, thinking that finally you would have control over drinks, just like the whole world has.
Yes.
Okay, but it is just that the brain is hardwired not for that kind of control.
I mean, you mentioned about AA, and I know that you've got a close association with AA. You've been a trustee here in India. Tell us a little bit about AA in India and how you sort of became involved with AA as well.
So it's a long story. I was in KEM Hospital.
Yes.
And I did my residency, and during my residence post in the de-addiction center, I spent a lot of time with alcoholics, with my all my textbook readings of alcoholism and drug addiction. And I really put in hard work. I was the only resident who would be there in the hospital till 10 o'clock at night, and again back for the rounds at 6 o'clock in the morning. And there were a few who appreciated that, and they were willing to work with me, and they did achieve sobriety. They were sober for 3-4 months. I was a fresher there.
Yes.
And after 4 months, all of them, one after the other, they relapsed. Okay. And I was very frustrated. Okay, I had no idea that this is a relapsing disease, and it was a book idea that it's a relapsing disease. But how it feels to a counselor, okay, that was very difficult for me. And I said that no more with addictions. Okay, I would go back to what we had, the psychiatry ward, that was ward 19, and ward 40 was no longer for me. But what happened was that I finished my graduation, and Dr. L.P. Shah, he said that you had taken keen interest, so you have to go back to the de-addiction ward. And it was for me like, Mandale, that's the worst kind of jail that you can go to.
Yeah.
I had no option. I had to listen to the authorities, and I went there. And all those guys whom I had written off from my diary, okay, were there ready to receive me once they came to know that I am back to the wards. And I said, how did it happen? And everybody said that it was Alcoholics Anonymous. So then I said, I need to read something more about it.
Yeah.
And then I started reading about it. That's how my journey began. Okay.
Yeah.
And I am a thorough man of science. That's what I believe. That's
Yes.
what I believe. Okay. And I am an Einsteinian atheist. Okay.
Yes.
If there is an opportunity to meet God and to know what God thinks, I would go with Albert Einstein to know what he thinks rather than meeting God. Okay. So I declare it. It's not that I don't declare it. Okay. But whenever I have felt that I have tried to read something about the 12-step program and how it helps the neurobiology of the brain, okay, the more I read, okay, I feel convinced that in each and every 12 steps that they have, there are influences which can be epigenetic and which can control the genetic expression, okay. And I'm still reading about it. It's a fascinating read. Okay, there are some books which have helped me tremendously. I had read The God Delusion long time back, in my student days.
Yes.
But recently I have read something on God Gene. Okay, by Hammer, and God Bomb by Professor Cummings. Okay, so. Those are, I'm reading right now these books, but what they talk about is the reward deficiency syndrome and the various genes that are engaged at different levels of exposure to these addictive substances. And what it does is that the expression in each individual, the quantity of expression might differ, and that's the reason why some people have an intense disease, some people have a milder disease.
Yes.
Okay,
Yeah.
so that is what I am reading about. But what I'm convinced is that apart from the individual CBT and the kind of treatments that mental health professionals offer, I am included in that. The medicines also. They help. It's not that they don't help, okay? But if that is supported with the community support systems, okay, then the effect size or the number of people getting better are likely to be more. I have read a bit about the Smart Recovery Program, which is, I think, a 6-step program,
Yes.
which is a concise program, and people feel that it's, the agnostic ones are the ones who would probably tilt towards a smart program. It's a fantastic program. It has the same enriched group features that an Alcoholics Anonymous has. The only thing is, in India, the accessibility to smart recovery programs is very limited. Okay.
Yes.
And I would want, through this podcast, if there are people who are doing smart recovery programs, please connect with us, and we will create a platform for smart recovery programs, just like we have a platform for the 12-step program. So it's anything that helps an addict or an alcoholic. We should be ready to try, because we know that we do face a wall in some patients.
Yeah, I mean, interestingly enough, 3 of us are actually just doing the facilitators at the moment for smart recovery.
Right.
So Obi, Ishita, and myself are doing that. I am aware also about smart recovery that I believe in Punjab that they have done some smart recovery facilitation with I think it was like with the police or something along those lines. There is some, but as you say, in India it's very limited at the moment, isn't it? And I think the key part here, as you say, is that part around about like-minded people and community and connection, which is so important for our clients. And those that don't fit for the the 12-step fellowship, they still benefit from that sense of being, a sense of community, being around people, going to a group, relating to people.
Yeah, so what is important is, so rather than going by hearsay, try to find out what you are comfortable with, okay? forget about the God part and everything, okay? Because I always say this, that if you believe in God, yes, certainly the 12-step program would be easy for you to accept.
Yes.
If you don't believe in God, okay,
yes,
even then you would probably be benefited with the 12-step program. But if you start believing that you are God, then it's not going to work. Okay,
that tends to be the problem, doesn't it? That's generally the problem. Yeah. I mean, I think one of the things that was, we do get a lot of clients that say, "I'm not doing this."
Yeah.
It's God, it's this, and okay, yeah, we know that it came from a religious group. That's the origins are. But if you take away that, there's a lot of very sort of guidelines for taking care of yourself, isn't it?
Yeah.
And I look at a lot of the stuff in there, and I can attribute it to other therapeutic approaches very clearly.
Absolutely. Simplistically put, the first step, okay, is about I can't.
Exactly.
Okay, so I can't get my recovery. If you had the recovery, you wouldn't come to us.
Yes.
The fact that you have failed doesn't means that you are not able to do something that you wish to do.
Yeah.
Okay. So when you come to a meeting, okay, you see people who have recovered. Okay, something can.
Yes.
Okay, so you get the knowledge that something can.
So we came to believe.
Okay.
Yeah.
So if that something is there that you don't know, so let that something reach you.
Yeah.
Okay, so they say let God. Okay, so I would say let that something reach you.
Yes.
Okay, so these are the first 3 steps. Okay, now the 4th step is that if you wish that something needs to come to you, okay, then you have to find out why till now it has not reached you.
Yes.
Okay, so once you go there, okay, well, we know that an alcoholic and drug addict doesn't have a simple life. Okay, he has a lot of complications. He lands up taking risks, and because of those risks, there are consequences on his own psyche.
Yes.
Okay, and there is a guilt and shame. Once the person wants to recover, there has to be a turning point where the disease has pinched him.
Yes.
Okay, now once the disease has pinched him, okay, there is going to be this guilt and shame and embarrassment.
Yes.
Okay, he would have to live with. Okay, because the world is not going to accept that, oh my God, he has done everything under the influence and so on and so forth.
Doesn't work like that.
So the 4th step says that first accept to you, okay, whatever, truthfully accept that, okay, these are the wrong things that I have done.
Yeah.
Okay, now, it's very difficult to accept your own mistakes. Okay, but you have to develop the courage of making a list of all the wrongs that you've done.
Yes.
Okay, and first share it with yourself, okay, and then try to have the courage to share it to somebody else. Okay, and that's what they call as sponsors.
Yes.
Okay, and then you get into the habit of correcting those wrongs. Now what we know is that this act of changing what you are trying to, what wrongs that you have done, okay, what's the purpose? The purpose is the release of the burden of those wrong things, okay, actually gives dopamine fixes in the brain.
Yes.
So what you're getting is dopamine fixes. Okay, so those are the dopamine fixes which start making a change. Okay, we actually know that in the striatal region, the D2 receptor, especially the long arm D2 receptors, which are extremely good for your recovery, they keep developing with these short, and that is the importance of making amends. Okay, and once the amends are made, okay, you reach to the maintenance steps. Okay, so the tendency to go back to drugs remains, because that has become the facilitated tendency in the brain. So the maintenance steps tell you 10th, 11th and 12th step, okay, come, you might go back or shift towards the disease circuits, okay, again. So you have to be very careful about your own thinking, feeling and behavioral patterns. Okay, so you have to keep finding out if your mind is again playing mischief with yourself, if the tendency to relapse is coming back through the back door. Now if you are able to do the maintenance steps, then the last step, that's the 12th step. So when you have learned these techniques and whatever good that you have learned from the 12 steps, you have to use it for others. Okay, but when you're using it for others, it is you that is getting the benefit. The other person getting the benefit is just the side effect. But what is important is that when you see others and you see your image of the past in him, that is the time that the release of dopamine starts happening even more smoothly. And then you practice all these things in your all affairs, not only pertaining to your addiction, but all the affairs. Okay. Now we know that this flow, okay, is not only for addicts. Okay. In India, I can proudly say that step 4 was done by Mahatma Gandhi. Okay. My experiments with truth. Okay. And he listed down all the wrongs that he had done. Okay, I don't see any other. So was he an alcoholic? No chance. Okay, he hated addictive substances. Okay, but you have, you can. Why do people feel the need to write autobiographies? Okay, where they mention what wrongs they have done. You come to an age where you want to write something about the right things and the wrong things, and that just makes your life little better.
Yeah.
Okay, so this tendency of writing about your wrongs, okay, journaling, we know that journaling works.
Well,
okay.
I mean, we do it in the program, but I mean, you look at doing step 10 with your daily inventory, isn't it?
Absolutely.
So it's very similar.
Yeah. So whatever you call it, okay, there has to be a process where you have to let others take the charge of your disease. Then you have to find out what is wrong with you and make a list and try to work on those wrongs. And then keep doing it. Okay, so smart recovery program is not any different. It's the same thing. Okay, the only thing is in the spiritual based programs, you would find that there are mentions of power higher than you. In smart recovery, they say that okay, the power is still with you. Okay, so bank on it. Okay, is it there? Yes, it's there in the genetic structure and the epigenetic influences which trigger these diseases. Okay, so for me, the enriched group is something which is important. Whether the smart recovery program offers you that enriched group, or the 12-step program offers you the enriched group, or a religious cult offers you that enriched group, I don't care. But the enriched group has to be in the place.
It's that mutual aid groups really is what the key sort of word, isn't it?
Yes.
Yeah. Just, I mean, you know, one of the things that you sort of mentioned about the particularly around about like step 4 and people sort of, you know, being talking about or, you know, putting stuff down in writing. A lot of people struggle at step 4. That's the sort of an action step as to so and people often sort of they get it's a difficult step, isn't it? But if I was to sort of say to you, you know, how group therapy, how do you see group therapy playing a role, particularly in a rehab centre? I mean, you've been to. I'm going to obviously use Samarpan as an example. You've been to Samarpan. You sort of have an understanding of the types of groups that we run and the interpersonal group therapy in the mornings that we do. So can you sort of maybe elaborate a little bit on
I have come to believe that in de-addiction medicine, okay, yes, individual therapy has its role.
Yeah.
Okay, but I believe that group therapy has a substantial role to play apart from whatever that happens in the individual therapy. Okay, there is a reason. The reason again coming back to science. In our brain, there are some neurons called mirror neurons. Okay.
Yes.
And those mirror neurons are the mirror neurons which get fired when you are in company with other people. And the connection between the mirror neurons of my neurons and Martin's neurons would happen if we have some kind of overlapping worlds. Okay. So that means if my experiences and Martin's experiences are similar, then those mirror neurons would fire. And if those mirror neurons are fired, then it becomes very easy to influence each other. So it's like, there was a famous Italian neuroscientist. They were working with monkeys, and what they were doing, that they had pinned those electrodes, the wireless electrodes in their brains, and they were monitoring the activities in various parts of the brain on the computer.
Yeah.
And these monkeys were kept in 20 different cages, and each monkey was given a peanut. Okay. And what they wanted to explore is that which areas get stimulated when the peanuts are given. Okay, and they were actually mapping it on the computer. But to their surprise, what happened was, when cage number 1 monkey was being given a peanut, okay, the cage number 20 monkey had the same stimulation. Okay, so that was something very surprising. They were able to understand that in each monkey, when the peanut was given, the same areas would get triggered. Okay, but they couldn't understand why, when cage number 1 was receiving the peanuts, why cage number 20 should have the same areas getting excited. Okay, so the anticipation was was sufficient to trigger those areas. Okay, so that is how the mirror neurons is. Simply put, we go for a lecture, and in the auditorium, once the speech is over, one person starts clapping and the whole audience then starts clapping.
Yeah,
that's another example of mirror neurons. Okay, and we know that for these mirror neurons to get triggered, there has to be some kind of a similarity between the perceptions and the environment that you have. Okay, and that is what is offered in the groups. And what I've learned from these people, I really say that I've been going to the rehab center and I've been observing Martin and Obi, and I openly say that, you know, I learned so much about how to conduct groups because I had not experienced it. Okay, in my training, there was not much emphasis on the group therapies. Okay, but how they try the individuals to focus on what they are supposed to focus and what they are supposed not to focus. Okay, that is something, and how the feedback is given to each other.
Yes.
Okay, so that horizontal facilitation, it's not only vertical, it's not that Martin is giving a suggestion, but the whole community gives suggestions to each other. And that's the healthy way of coming together, because then you are ready for the support groups in the community. Okay, so you start getting help from these mirror neurons that have gotten excited, and you start working as a group. And that's the importance of Samarpan support groups that we have.
Yes. Yeah.
And that is the reason why we have so many recoveries.
Yeah, I mean, I think, you know, to be honest, I mean, if I look at sort of over the last 2 years, I mean, we've got a lot of, there's a significant percentage, isn't it, of people that are doing really well, you know, and remain, and for those that are even maybe struggling a little bit, they're still sort of engaged and in touch, and the bulk of them.
Yeah.
So I think that's been one of the kind of the. I mean, I'm mindful of the time because we obviously we could talk for probably another 2 hours here, Ashish. And what do you see sort of some of the changes in India? I mean, you've been working in this field. I only got here 2 years ago, so I sort of got parachuted in from Thailand, and then Obi sort of joined me from the UK. What do you sort of see some of the changes in India, and what do you see as some of the sort of changes that, you know, people, I mean, I'm not saying about like myself, but, you know, having, you know, some different approaches coming into India, what do you sort of see as some of the changes that have been happening?
Well, it's a scary scenario. You must have heard about what happened in Pune just a week ago. There was some kind of 1,000 kgs of meow that was caught.
Yes.
Okay, mephedrine was caught.
Yeah.
And this is just one catch. Okay, and I believe that the problem is menacing. Okay, it is growing at a very rapid rate, and the young population is getting involved at a very, very fast rate. So it's a scary scenario. Unfortunately, the kind of treatment services that we have are hardly going to cater to any of these suffering addicts and alcoholics. Yes, there are supported admission centers which are required if there are co-occurring disorders. Okay, but many a times in many of the rehabilitation centers, the kind of interaction that happens with the addict and an alcoholic is not necessarily respectful. Okay, and that keeps the addict and alcoholic away from treatment facilities. It's a very unfortunate scenario, but that's what has been happening. And what I feel is it is high time that people understand that there are various ways of motivating the person to get into treatment. Okay, we know that there are two approaches: confrontational approach and motivational approach. With confrontational approach, okay, the longer run is not very pleasant. Okay, the recoveries happen more with the motivational approach. So you need to have a motivational therapist engaged in whatever stage. Yes, if there is a co-occurring disorder where the person has become so aggressive or suicidal or has gone really berserk, and there are lots of illegal things that the person is repeatedly doing.
Yes.
Yes, at that time you do require a supported admission or admission against the will of the patient. But beyond that, I don't think any reason why you can't, you require the supported admission. It has to be with the consent.
Yes.
Okay, and that is where I think the whole team is trained to engage the person and increase the level of engagement to either the intensive outpatient program or the rehabilitation center. So we have the whole gamut of levels. Okay, and the other thing I think is it's a familial disease, so the family also needs to attend to the treatment program. It's not only that the individual, the unfortunate addict or an alcoholic is suffering and has a problem. Many times the family might unknowingly facilitating the disease.
Yes.
So the family members also need some kind of change that they need to bring about in their patterns of interaction.
Yeah.
And I suppose we are looking for that kind of overall change and support to the family when it comes to recovery.
Yeah, I think that's a good point. Particularly the family. I think, without, from my take, really, without any family involvement, it's very difficult to work with clients.
Yes.
I think
Absolutely.
it's a little bit different maybe working with Western clients where they might not have so much attachment to families, and some people are very much not, they're a bit more isolated. But generally, my take is even with people from Western cultures, they benefit from having family involvement.
Yes.
And I think it's a key component. I think any program that is not offering any sort of family component is probably not really giving enough, credence to what the issues are presenting for that client and the benefits of it. Because I think, we see it, don't we, sometimes. I mean, you've seen it where clients, the communication within the family, the reactions that go on, the interactions, the transactions that go on within the family. If we can't sort of set a ground, sort of some foundations in improving that, then we're basically throwing people back into the fire.
Even beyond families, if the employers are able to engage meaningfully with the treatment programs, and that's the reason we have this employers assistance program.
Well, we don't have it quite yet, but we're in the process.
But we are in the process because we do know that employers, if they are supportive of the addict that they have in their on their benches, okay, that would benefit a lot in getting the addicts act together. Okay.
Yeah.
So it immensely helps if the employers are engaged in the treatment program. So you have to look at it as a disease. You can't be looking at it as a sinner or a sin,
a moral failing.
Yeah, moral failure or something.
Yeah. I mean, that's a good point about employment, and I can relate to this back in the UK and with Transport for London. I mean, I think they have their own sort of the EAP, and the fact is that they are very supportive about putting people into treatment, because the cost of training a train driver is something like £63,000. I might be wrong, but it's a lot of money.
Yeah.
Whereas they can put someone into treatment for a third of the cost.
Right. Absolutely.
It's a no-brainer, isn't it?
Yeah.
As you say, and it's not it's not a moral failing.
Yeah.
So just to sort of end up with just sort of a rounding up a question for you as I'm mindful of the time, and we'll probably do a second one of these, Ashish, because I think you've got so much more that we could probably talk about. Can you just sort of just in terms of like for Samarpan, I'm just going to. I mean, you come in, you come out, you've met. What do you see the differences between Samarpan and other programs within within India? What do you see as what do you think Samarpan offers for people?
Well, I've worked for the last 30 years in the rehab centers, and I know for sure that if anybody survives in the rehab center for more than 3 years, then he has to have the passion for the suffering alcoholic or drug addict. But all of us are human beings, and if the patient doesn't recover, the frustration gets the better of you. And at that time, if you don't have a support which you can talk to somebody about, okay, then sometimes you just land up crossing the borders. Okay, and it can happen to the best of us. It can happen to the therapist. Okay, and then something that happens in the rehab centers may be happening because of this tendency, but there is a lot of things happening which should not be happening in the rehab centers.
Yes.
Okay, so what I feel, what is the difference here is that we have all evidence-based interventions. Martin would agree that we hardly use medicines, but we are not against medicines.
No.
Okay?
I mean, they absolutely
right.
have a
and
place.
our clients would vouch for
Yes,
it. That,
yeah.
I give medicines when sometimes I have to tell them that no, I won't give you the meds. Okay, and so that time, all these guys are after me and glaring at me. Why? Because I know where I have to stop. Okay, so we try to use the least possible medicines.
Yes.
But at the same time, we believe in judicious use of medicines. Okay, so we do say that yes, medicines do help recovery, but we don't totally depend on them.
Yes.
Okay, we have to be an alert mind to
Yeah.
keep away from the drugs.
Yeah.
So I think, and we have the support systems. We have multi-faculty approach at the rehab center. We have associations with multidisciplinary hospitals. I think in all, it's we are heading towards something which is state of the art. Okay, and we have the expertise, and we are there to serve.
Okay, well, we'll finish there. We'll do a part 2 for sure. Definitely a part 2 because there's probably
See you
more. Thank you very much. Thank you, Ashish.